The program you're about to see is intended to explain the cardiac surgical experience. In the next few minutes, you're going to meet some of the members of the team that will be caring for you. You'll see the facilities where you'll stay, and you'll learn about the recovery process. After viewing this video, you'll be better prepared to undergo the surgery. It's important that you learn about what will happen before it happens. Please call us if you have any questions or concerns after watching this program. Cedars-Sinai Medical Center is one of the foremost medical institutions in the world. It has distinguished itself not only as a major clinical center, but also as a research institution with impressive growth. The divisions of cardiothoracic surgery and cardiology are also world famous and provide the finest care available to patients with every type of heart problem imaginable, from the most basic cardiac care to heart transplants. For many reasons, arteries to the heart can become blocked. These blockages slow down the flow of blood to the heart, making bypass surgery necessary. Bypass surgery takes veins and arteries from other parts of the body and goes around the blockages. This new vessel then allows enough blood to flow through the heart so it can function more efficiently. Your preparation for surgery begins with the cardiac surgery liaison nurses. They'll be coordinating your date of surgery and telling you what you need to do before and after surgery. They also will be an invaluable aid to your family the day of the surgery.
The day of surgery is a very emotional time, very stressful time for the family and the friends of the patient. And everybody deals with this in a different way, so we try to be there for them, catering to their needs, answering any questions that they have, trying to alleviate any fear that they may have by, telling them that everything is okay, listening to all the things that they have to say. We try to be very sensitive to their needs.
If you're having elective surgery, you'll be asked to have many of your lab tests performed well in advance of the actual operation. The liaison nurses will arrange for your electrocardiogram, chest x-ray, and blood tests to be performed before you come to the hospital for surgery. All these tests should be completed 72 hours prior to the surgery. If the tests are not done then, they will be done the day that you're admitted to the hospital. Certain medications, such as aspirin, should not be taken for at least 7 days prior to surgery, and if you're taking Coumadin, this must be stopped several days prior to admission. These are important issues that you should discuss with your doctor. During and after surgery, many patients may require blood transfusions. Due to the publicity associated with blood transmission of AIDS and other viral illnesses, many patients are appropriately concerned about blood transfusions.
There are two major factors that have to deal with the safety of the blood here at Cedars-Sinai. Number one, our donors are very intensively screened by the nursing personnel, and it's an all RN nursing personnel that we have, and their physicals are all taken here in the donor room. After that, when the blood is drawn and it goes up to the blood bank, the testing is done, and there are 6 full tests that we run on each unit of blood. And our major tests are for AIDS, and for hepatitis, and for syphilis.
Also, there are several things that you can do to further reduce the risk of complications from blood transfusions. If your surgery is scheduled for a future date, it may be possible to donate your own blood.
Since the patient is going into surgery, we want to make sure that their own red cells, their own count is at a good level prior to going into surgery. So therefore, they must schedule their procedure, their autologous procedure, at least 72 hours prior to surgery.
This technique, which is called autologous blood donation, means that the patient gives his or her own blood. The blood is stored until it's needed by the patient. But before you can donate, you must get clearance from your physician or surgeon.
Many times, patients can get in at least 3 to 4 units prior to their surgical date because they can donate at least once a week prior to the surgical procedure.
Your own blood is best for you, but if you're unable to donate yourself, another way to make patients feel more comfortable about receiving blood is to have relatives or friends donate their blood. This is called directed donor blood.
Directed donors are most grateful that they can participate in the patient's care, because after all, they can't do the surgery, nor can they give direct patient care, but they can give the one most important thing, and that's the gift of life. That's blood.
Before contacting the blood donor facility to schedule donations, please consult with your liaison nurse and get clearance from your physician or surgeon. You'll be receiving booklets on blood donation, which should answer many of your questions. However, if you have any other questions regarding blood donation or transfusions, ask your surgeon or liaison nurse.
The wonderful preparation that my doctors gave me about every step of the way about what was going to happen was tremendously reassuring, because there are no surprises. And when there are no surprises, you're prepared to meet each one of the things that in the sequence of events. And that's, I think medicine has come a long way in making the patient a partner in the process.
Generally, you'll be admitted to the medical center the evening before surgery or very early the morning of surgery. One of the first things that might be done prior to surgery is a procedure called vein mapping. The vein used in your bypass will come from your leg and is called the saphenous vein. The main purpose of vein mapping is to check the quality of the veins to be used during surgery. Before surgery, you'll be visited by a number of professionals, including a cardiothoracic anesthesiologist. You'll be asked about prior surgeries, your general medical condition, and whether you have a history of allergic reactions to drugs or anesthesia.
Did you have any anesthetic problems at all with the surgery?
No, I've never been allergic to anything like that.
If you're taking any special medications, such as insulin for diabetes, be sure to mention this to the anesthesiologist. Remember to talk about all medications.
One of the times that becomes very important for the patient is that after we've conducted our history and physical examination and we've discussed the procedure and the potential complications, we really encourage patients to go ahead and ask us questions. I think the more questions that they ask, the less anxiety they have about the procedure, the less anxiety they have about the people who are either going to do the surgery, who are going to do the anesthesia, or who certainly are going to be managing their post-operative care.
Okay, just go ahead and open your mouth wide. Deep breath.
Before surgery, one of the residents or physician's assistants will be performing a physical examination and interviewing you about your medical condition.
How much you smoked in the past.
You'll also be seen by your surgeon. Though he may already know you very well, he'll be asking some of the same questions he asked before and will explain some of the things to expect over the next few days.
One of the most important aspects of the pre- and post-operative period dealing with various members of the healthcare team is that the patient and their family feel comfortable that any questions they might have get answered. Clearly, if they forget to ask the surgeon a question, if they think it's appropriate for the surgeon to be answering it, then they should just write it down or ask the nurse to call the surgeon, and it'll get answered whenever the surgeon comes by the next time. The most important thing is for them to be unafraid to ask. Patients recover quicker when they're knowledgeable and they're not fearful.
Well, most of the questions have been answered. You feel
We also go through all the different machines and all the different lines, tubes, and equipment that is available that will be there after surgery when the patient's in intensive care, so that both the patient and the family knows that all this equipment is normal and is routine. It's not because they are not doing well. But whenever some additional information they need, or if something happens and the nurse in intensive care doesn't have the time to really explain to the patient or to the family, they will call me. They will always page me. I'm always available.
As you know, there are potential complications from any medical procedure. The Cedars-Sinai Division of Cardiothoracic Surgery takes pride in the fact that its complication rate is one of the lowest in the country. The chance of a complication occurring depends on a number of factors. Your surgeon will review each of these factors with you in detail. Patients admitted the day before surgery will start preparation in the evening. The nurse will give you a mild sedative to help you sleep. It's important that you have a good night's sleep the night before surgery, whether you're in the hospital or at home.
On the day of surgery, the family may come to visit before the patient leaves for the operation, or we recommend that they visit after the operation's been completed. On that day, the patient is shaved from the neck to the lower abdomen, and also both legs are shaved. The patient showers with some special soap and is given a sedative, either a shot or a pill, to relax him before he leaves for the operating room.
While in a light sleep, the patient will be moved to the operating room. Once there, the anesthesiologist will start an intravenous line and give additional sedation to help you sleep. The usual time for surgery is anywhere between 3 and 5 hours, depending on what needs to be done. Your family will think the surgery is much longer, not only because of their concern, but because of the 3 to 6 hours of preparation time both before and after surgery. So for the family, the day of surgery may mean up to 10 hours or more of waiting.
The nurse is coming out to every hour to explain exactly what it is that the doctor is doing or what stage he's at. And just that alone, you know, just keeping you posted. And the fact that there are no complications, it's just nice to know, because, you're sitting there, you're tense, you don't know what's going on inside.
The 6th floor lobby outside the cardiac surgery area is where your family will be asked to stay during the surgery.
It's a common tendency for the family and friends out in the lobby to try to compare their patient's experience with what's going on with other patients, either that day or friends that they've had that have been through this operation. What you need to keep in mind is that every patient is different and every surgery is different, and everyone is going to have a different experience. Everyone is going to recuperate at a different rate. Things are going to be different from patient to patient, and the families and friends really do need to remember that.
The liaison nurses will be in touch with your family a number of times during surgery to keep them informed of the patient's progress. Should members of the family have a question for the liaison nurse, and if she's not right there at that moment, then you can ask a Heart Families volunteer to page the liaison nurse.
It's nice to have these people around because, especially if you've never been through this kind of thing. She herself had surgery, and they're experienced people. They've been through it, and they're just here just to give you moral support.
When we're around, we talk to people. We try to get them to open up and talk to us, ask them if there's anything we can help them with. If they need any social services work, we can arrange for a social service person to come and talk to them. We just try to get them a little relaxed during their time of waiting for their person to come out of surgery. I remember when I was waiting all day, I'd have given anything for somebody to talk to besides my kids and my family, because they didn't know any more than I did. And I feel that these people appreciate that.
When the surgery is finished, the liaison nurse will direct the family to the surgeon's office.
The initial conversation that I have with the family members right after surgery is over with is a time when we discuss the actual findings at surgery and the actual procedure, what we did. And then on the basis of that, I form what I consider a prognosis for recovery.
The Cardiac Surgery Intensive Care Unit, or CSICU, will be the patient's first stop after surgery. This is where all cardiac surgery patients go through the early stages of recovery. The staff members in this unit are specialists in the care of heart surgery patients. Another important member of the team is the surgical cardiologist.
Hi, how are you doing? I'm Dr. Khan. I'm one of the cardiologists that works with the surgeons here.
I'm doing very well.
Okay, great.
Yeah.
Any chest pain or discomfort up there?
No.
The surgical cardiologist and your family doctor will be involved in your care from the time you arrive in the CSICU to the time of your discharge. The CSICU nurses are highly experienced and specially trained in the post-operative care of cardiac surgical patients. On the day of surgery, there will always be at least one CSICU nurse specifically assigned to you. Most of these nurses work on 12-hour shifts. When on duty, their only responsibility is you.
On the day of surgery, it's one nurse to one patient, so that family members can rest assured that their loved ones are being cared for every minute of the time that they're in the intensive care unit.
Another important member of the team, the cardiology fellow, is a doctor who's undergoing additional training in cardiology. A key part of their training is the post-operative care of heart surgery patients.
He's a 62-year-old male with a history of angina and ventricular tachyarrhythmias who underwent coronary bypass graft surgery.
They are very experienced in both intensive care medicine and cardiology, and their sole responsibility is to care for patients who have just had heart surgery. Cardiology fellows work on 12-hour shifts, and one is always on duty. In addition, you may also be cared for by a physician's assistant.
One of the big roles that physician assistants play at Cedars-Sinai Hospital is our interaction with the patients during their entire hospital stay. As I mentioned earlier, we see the patients on the day of their admission. In fact, many times we do their admission histories and physicals, orient them to the hospital or their medications and their laboratory tests. Because I'm with the patient on a daily basis, I can address many questions that the patient have. Very frequently they have questions that I myself cannot answer, but since I communicate daily with the other members of the staff, including the cardiac surgeon and the cardiologist, these questions can be answered in a rapid manner, which will alleviate any fears or problems that the patient and the family may have.
If the family wishes to get information over the phone, assign one family representative who will be responsible for calling the hospital, checking the patient's status, and then calling other family members with the information. This allows nurses to spend more time nursing and less time on the phone. Patients usually recover from anesthesia by evening on the day of surgery. When patients awaken, they'll be most aware of the tube in their throat, because it'll be uncomfortable and they'll be unable to speak. Also, their arms will be in soft restraints to keep them from pulling out any tubes. The tube in your throat is called an endotracheal tube, or ET tube. The ET tube is connected to a respirator that helps the patient breathe during and after surgery. Within a day of the surgery, the patient should be breathing on their own again, and the ET tube will be removed.
This tube allows your lungs to be filled with air, and it also allows the air to be exhaled. So as you wake up, you will be able to take breaths on your own, even though you have this tube in your throat. And once you are awake enough, and I can consult with the doctors as far as whether or not you can breathe on your own, then we will take that tube out.
Following surgery, most patients need to stay only one day in the CSICU. During this time, the patient will begin breathing on their own, have most of the tubes removed, sit on the edge of the bed, and even stand to walk a few steps. If stable, the patient will be moved to the monitored unit on 6 Northeast.
The fascinating thing about directly after surgery is awakening from the anesthetic in the room and looking around and saying, hey, I made it. It's over. It's terrific. There's a tremendous, wonderful feeling of euphoria and accomplishment, and you made it through. And of course, you're still a little dopey, so you don't really feel anything physical, but mentally, it's a wonderful feeling.
What they're going to do with me today, they move me into a regular room with a TV and dancing girls and all that.
Okay.
Many times, the family is concerned when we move a patient to a regular bed within 24 hours of surgery. It's important to realize that the move to 6 Northeast is a positive move, a first step toward recovery. And while it's important not to push too hard, getting back on your feet quickly has been proven to speed recovery and prevent certain complications. 6 Northeast is a section of the cardiothoracic surgical floor in which patients are electronically monitored 24 hours a day.
Patients after cardiac surgery might develop at times either arrhythmias or conduction disturbances. Our main task as an EKG technician is to promptly detect, diagnose, and inform the nurse in order to be able to take measures right away and to solve the problem.
After surgery, about 1/3 to half the patients develop an irregular heartbeat. This is not a dangerous or life-threatening condition, and it's quite common. Our treatment is simply to give some simple medications to calm the heart down and regulate the heartbeat, and usually within 1 or 2 days, patients will return back to a normal, regular heart rhythm. We usually continue these medicines for 4 to 6 weeks, and then we stop them. This has no long-term consequences and is not a dangerous condition at all for the patient.
One of the most important things a patient can do to speed their recovery is to use a TriFlow.
The reason that we want you to do the triflow coughing every hour and to every 2 hours is because that collapsing in the lung that can happen, and after surgery everyone has a bit of collapsing of those little air pockets, can lead to an infection such as pneumonia. We're going to have you do it every hour, 10 times each hour. Okay, so go ahead and put it in your mouth. Forcefully exhale, and just as forcefully and immediately inhale.
If this is done correctly, after a few breaths, the patient will cough. Coughing will not hurt anything or cause the incision to come apart. The nurse will demonstrate how to use a pillow to help with coughing.
I want you to put a pillow to your chest and kind of hug your chest when you cough, because sometimes that can take some of the pressure away from the incision. Now, take a deep breath and just forcefully exhale.
Oh, boy.
And is it hurting a lot when you cough?
Well, it's, I don't know what the degree, it's a little painful.
Okay.
Got
Very
it all.
good.
Walking is a very important part of the recovery process. Therapists, in addition to the nursing staff, will be helping you out of the bed for short walks down the hospital corridors. We encourage the patient to get out of bed as much as possible. This will speed recovery. The chest incision may not hurt as much as the leg does. If there is pain, ask for medication, but pain should not prevent the patient from walking. The leg from which the vein was taken may be black and blue or swollen. This will improve in a few weeks. Sometimes the surgery may cause the patient to experience some back pain, especially on the left side. Remember, some pain is normal and is part of the recovery process. Over the last 20 years, we've learned that it's best to get up and move about as soon as possible after surgery. Staying in bed slows the recovery process. We encourage the patient's family and friends to help in basic care, making the patient feel more comfortable, helping with meals, and walking with the patient in the hallways. Patients appreciate it, and the family feels more involved. Throughout the patient's hospital stay, some of the staff will be giving classes on heart problems and recovery from heart surgery. The lectures will cover such things as diet, exercise, habits, common feelings after surgery, discharge instructions, and recovery. These are important lessons because heart surgery doesn't cure the cause of the problem. A successful recovery depends largely on how well the patient follows these suggestions. After staying on 6 Northeast for about 2 days, the patient will be transferred to the non-monitored area further down the corridor to 6 Northwest. About the same time, the staff will remove wires that were placed during surgery to help your heartbeat. The stay on 6 Northwest allows the patient to gain more strength and to improve their appetite. It's not uncommon for the patient to experience some constipation for a few days following surgery. The combination of medication, too little walking, and no solid food causes this. Once out of bed, a patient's bowel movements will improve. We encourage patients to walk as much as possible, to act as if they're at home. All this walking may tire the patient, but fatigue is normal after surgery. The key is to pace your activities. It's okay to get tired, but you should avoid becoming exhausted. After 2 to 4 days on 6 Northwest, most patients are ready to go home. Another member of the cardiac team is the cardiac surgery social worker. Social workers help with the special needs of certain patients after they've had surgery.
A patient or family can, and they frequently do, just contact me directly if they feel that they have some concerns and anxieties and they need some support through the process. Very often, though, the cardiac liaison nurse may identify people they ask me to see. I'm also available to answer questions about discharge needs and can set up short-term rehab if needed, arrange for homemaker attendant care, visiting nurses, meals on wheels, support groups or individual therapy.
On the day of discharge, usually 5 to 7 days after surgery, the patient is given medications needed at home. This will usually include aspirin, iron tablets, and vitamins. For the first few weeks, patients can eat almost anything they like, except for diabetics who should strictly adhere to their diabetic diets. A few advantages of at-home recovery are familiar environment, better sleep, a normal diet, and reducing the chance of hospital complications. When the patient feels stronger, about 3 to 4 weeks after surgery, he or she can think about a change in diet to keep cholesterol level and weight under control. Some weight gain after surgery is normal. This is only temporary water weight gain caused by all the fluids that were given during and after surgery. As mentioned earlier, the patient may experience some leg swelling after surgery. This is caused primarily by the removal of the vein, but is also a side effect of water weight gain. When resting or relaxing, it's very important to elevate this leg higher than the level of the heart. Eventually, the swelling will go away as other veins in that leg take over the workload. Many patients, especially patients who have internal mammary bypass grafts, experience pain or a change in skin sensation near and around the chest incision. Numbness in the shoulders, arms, and hands is also common. The pain should slowly subside over 2 or 3 months and then go away. The patient may also experience some additional side effects: loss of appetite, short attention span, mood changes, temporary memory loss, and occasionally blurred vision. The patient's first follow-up visit will be with their private physician within 7 to 10 days after discharge. The liaison nurse will call about 3 weeks after surgery to see how the patient is doing and set up a follow-up visit with the surgical cardiologist. Our department likes to keep track of how patients are doing after discharge. During this follow-up visit, the surgical cardiologist will discuss specific aspects of patients' recovery and make recommendations on improving their lifestyle. 6 weeks after surgery, most patients can return to all of their regular activities, except for activities that place too much stress on the breastbone. The breastbone will not heal completely for at least 12 weeks. The patient can now drive, travel, including airplane travel, return to a normal sex life, go to the movies, restaurants, concerts, and even return to work. These activities should be done at a reasonable pace. If the patient becomes tired, they should rest. As their activity increases, their strength increases. Avoid heavy lifting or strenuous household activities like doing the laundry or washing windows. Stay away from full participation in sports like golf, tennis, or strenuous swimming. It's okay to wade or exercise in a pool, ride a bicycle, or do light golfing like chipping or putting. An internist or private cardiologist may recommend an exercise program. Many people choose formal cardiac rehabilitation programs to help them recover and establish a permanent exercise program. These programs teach about the importance of exercise, how to start exercising, and how to know one's limits.
We hope by the end of their time with us in the program that they are able to independently handle their own risk factor modification, thus hopefully preventing their needing to have a second bypass surgery.
On your days off from cardiac rehab, you should plan on dedicating approximately 1 hour to walking. Walking has been shown to improve the overall health of your heart. It should reduce the chances of a future cardiac event and will probably prolong your life. Eventually, you should try to walk at least 3 miles in 1 hour. This is a modest pace. Most people reach this goal in a few weeks.
Somehow, the grass is greener, the roses are redder, the sky is bluer. I've become a much happier person. Almost everybody is conscious of their condition before you go into heart surgery, whether it's a month before or a year before. And when you become conscious of that, you start being careful mentally about what you can do, what you can't do, should you push yourself. And that's all gone. You can do whatever you want to do, you know, within reason.
The last thing to be discussed at your follow-up visit will be risk factor reduction. Before surgery, the patient had significant blockages in their coronary arteries. Bypass surgery does not cure those blockages. It only goes around them. The process that caused those blockages can also affect the bypasses themselves. Bypass surgery is not a cure. It's a new start. There are many risk factors that contribute to coronary artery disease. Of those, 7 are especially important: family history, smoking, diabetes, high blood pressure, high cholesterol, inactivity, and stress. Of these, we can only control 6. As yet, nothing can be done to change your family history. Study after study has shown that smoking causes major damage to our cardiovascular system, and that the threat to our arteries is greater than the threat of lung cancer. Patients who continue to smoke after bypass surgery can be expected to block their grafts sooner than those who do not smoke. In fact, if you're undergoing heart surgery, quit smoking. Because if you intend to smoke after surgery, there is very little reason to have the surgery in the first place. Patients with diabetes should stay in close contact with the physician who's treated them for this disease. Control of blood sugar after heart surgery is just as important, if not more important, than control before surgery. Many patients have high blood pressure before surgery. After surgery, adjustments in blood pressure medications are often necessary. Poor control of blood pressure after surgery can worsen blockages in your arteries and bypass grafts. Many studies are now showing that poor control of cholesterol after surgery increases the rate of blocked bypass grafts. Cholesterol levels need to be carefully monitored and diets carefully followed. If diet alone is not successful in reducing cholesterol to acceptable limits, medications may be necessary. We have already discussed the importance of planned exercise. It can become your form of meditation, and it's a great way to deal with stress as well. These exercises need to become a mandatory part of your lifestyle. Stress reduction is an important part of your recovery. There are many ways that people reduce daily stress. Some have quiet hobbies, some meditate. Select whatever works for you and use it. Since the early 1970s, the Division of Cardiothoracic Surgery has collected and stored data on all patients who have had cardiac surgery at Cedars-Sinai. This information has been published in numerous journals and has had a major impact on the care of patients not only at Cedars-Sinai but throughout the world. Former patients receive a mail questionnaire every year so that the hospital can keep track of one's long-term health. This is very important as a source of information that's used to establish standards in the treatment for others who will have bypass surgery. Our objective with this program has been to educate you about bypass surgery. Having an overall knowledge of what's to come is a positive step for the patient, staff, and the family. It is our belief that the more educated you are, the better your mental attitude. The better your attitude, the closer you are to a speedy recovery. I had my surgery a year ago.
It's really very gratifying to see people who have been incapacitated in one way or another prior to surgery being able to be restored to a more normal lifestyle.
It's great to be able to be there and watch this patient improve and do well and know that they're going to have a better life and a better quality of life because of the work you've done for them.
One of the real satisfactions of my job is to have patients come in that I don't know, see them not only successfully go through the operation, but through the intensive care unit and leave the hospital and have normal lives, or lives better than they had when they came in the hospital.